Joining us now for some perspective on the healthcare ruling is UK economics professor Aaron Yellowitz. Professor, thanks for speaking to us from campus there. What impact does today's ruling have on the economy?
Well, the biggest impact that this has is, in my opinion, making the financing of healthcare reform more sustainable. The individual mandate, which the Supreme Court ruled on today, and basically with a little bit of language changes called it a tax, basically means that everyone has to purchase health insurance or pay a tax, and the anticipated effect is that people will purchase the health insurance. And it turns out that what that ultimately does is provides cross subsidies from relatively healthy people to sicker people in purchasing health insurance. Well, so it actually shores up the financing.
So is that how this is supposed to work for somebody, who already has coverage, and most of our viewers out there I'm sure do, but what impact does someone else's lack of coverage have on everybody else?
Well, there are what economists think of as relatively modest effects of the uninsured on healthcare costs. Turns out that the cost of the uninsured in terms of total healthcare costs is around 2 or 3% of total costs. So if the motivation for the individual mandate was simply to make people who were using emergency rooms pay for those sorts of costs, then it seems like a fairly blunt instrument for doing so. So the bottom line would be the uninsured tend to have relatively small effects on those who already have health insurance, despite arguments to the contrary.
Healthcare is a large segment of our overall economy in this country. Hospital and insurance stocks have been jumping around after that ruling. How do you expect them to settle?
I think in general, profits for healthcare companies will be lower. I think that this is a fairly costly piece of legislation. It will have impacts with respect to jobs, with respect to profitability, and so forth. It does have benefits for some people. It dramatically increases the number of insured people, reduces the number of uninsured. But to say that it will have all positive effects on the economy would be hopelessly optimistic.
UK economics professor Dr. Aaron Yellowitz joining us on short notice, and we appreciate that very much. And we hope you'll stay with us.